Welcome. This business continuity planning COVID-19 return to work presentation is an update to the live webinar broadcast on the 12th of June 2020. It contains some updates which reflect present day status, particularly in British Columbia. It remains entirely relevant and to a broader audience as we see further challenges associated with accommodating adjustment, not just in the workplace, but in communities and in people. We do see concerning behaviours. This is the Lionsgate Risk Management Group view of the phased return and its challenges. I invite you to visit our website at www.lgrmg.ca to gain some insight into Lionsgate and what we are all about. My name is Mike Franklin and I am part of the Lionsgate Risk team and delighted to present to you today. My credentials are also posted to our company website for your consideration as you try and judge whether I know what I might be talking about. I would also like to thank my colleagues Mike McCafferty and Susanna Perpick for their invaluable support assembling this input. With many businesses now returned to work in some capacity and more businesses in more sectors now able to operate, the emphasis in the early slides in this presentation is towards validating what you have already done versus what else you could and should do to protect business viability and continuity. This presentation seeks to service three audiences: those already returned to work, those transitioning back to work, and those yet to return to work in any capacity and planning that eventuality. We're not here to teach you the obvious, the readily apparent, but to give you a measured, experienced perspective, essentially a checklist to help you manage your security risk and identify gaps. We're also providing access to a number of resources and related services accessible through our website. So again, note our web address www.lgrmg.ca and access the Business Continuity Webinar Resources link on the home page. Hindsight is 2020. I'm not sure anyone outside a medical specialism could have predicted the reach and impact of COVID-19. In fact, latterly, even the medical profession is struggling to reconcile their view of the virus. Consider also the lack of consistency across the globe in addressing the spread of the virus and just how far-reaching that is in terms of any return to normality. Currently on the front burner, border integrity. For all businesses, continuity plans now need to be dusted off. The worst case scenarios documented in security manuals for pandemics in previous years have come to pass, with a pandemic event of an unprecedented magnitude. For some businesses, COVID-19 has been catastrophic and they've been unable to survive. Arguably, many of these businesses, whether they had a comprehensive business continuity plan in place or not, would have seen the same dire outcome. They have been victim to circumstance. Other businesses still operating have significant challenges to maintain that status, and in doing so should have some yes answers ready for the following questions. Have you assigned staff business continuity and resilience responsibilities? Do you have an organizational COVID-19 lead? Have you undertaken your return to work risk assessment? And what was the COVID-19 impact on your business? A second wave seems almost inevitable, so what would a future COVID event look like for your business, and how can you minimize the impact of another enforced closure? This presentation is extremely relevant as we work together to support organizational transitioning back to work within the levels of normal operational function that health agencies and federal and provincial governments are permitting. It's becoming increasingly clear that a full return to pre-COVID working conditions is not going to happen. That places a massive amount of stress on every person in every environment, and this plays into increased frustrations and less control under provocation. In our earlier live presentation, we highlighted media coverage of some acts of violence as a consequence of COVID restrictions and concluded that tempers may flare at workplaces. Violence levels have since escalated considerably due to a whole combination of factors. Self-isolation suddenly and fundamentally changed our lifestyles, and with consequences. How we move, where we go, how we work, how we play, who we spend time with or not, and who is watching us. This has a huge impact on our mental health and our behaviours, and no one is immune. Whatever the interaction, a core consideration as you seek to remain calm is what might be in play in the background in a restricted existence, as well as in the foreground in that person's world. Violence is not excusable, but de-escalation techniques can remove violence from the equation. Potential security risks for a COVID-19 return to work and appropriate countermeasures will vary based on business type, function, the number and type of customer interfaces, talk, touch, etc., business size and location. Finally, the robustness and COVID-19 adaptability of existing security measures. WorkSafe BC instructions are to assess the risk at your workplace, implement measures to reduce that risk, develop policies, develop communication plans and training, monitor your workplace and update your plans as needed, assess and address risks from resuming operations. Further, organisations must be aware that workers have the right to refuse work if they believe it presents an undue hazard. An undue hazard is an unwarranted, inappropriate, excessive or disproportionate hazard. For COVID-19, an undue hazard would be one where a worker's job role places them at increased risk of exposure to the virus and adequate controls are not in place to protect them from that exposure. You can refer to WorkSafe BC Guideline G312, Refusal of Unsafe Work. More generally, in the current climate, security risks should be managed using risk-based and performance-based management processes and with a prioritised focus on reducing frustrations caused by COVID-19 restrictions and the increased potential for incidents of workplace violence. In addition to WorkSafe BC safety planning, let's look at the central requirements of the BC Government COVID-19 Go Forward Management Strategy. In the Go Forward Management Strategy, the BC Government introduces core measures to implement safe organisational practices to reduce transmission. Actively promote and monitor personal self-care actions in your organisation. Actively promote and implement the core measures for managing social interaction in your organisational setting in congregate social settings, such as kitchens, staff room, canteens, shared open spaces. You should have clear policies to enable and ensure that individuals who have the symptoms of a cold, flu or COVID-19, including coughing or sneezing, should not come into the workplace. As part of your specific settings, you should implement sick day policies for the coming 12 months that actively work with individual staff being off sick more often or working safely at home during these illnesses. As employers, you must take leadership in this regard with routine screening and questions of staff for symptoms checking. You should require and sustain higher levels of frequent cleaning of high-touch areas in workplaces and retail outlets throughout the day, and availability of hand sanitizer stands at entrances or around workplaces and shops. Where appropriate and practical, increase the use of temporary physical barriers, such as plexiglass at service counters or checkouts. Focus on how you will support and accommodate higher risk populations, including those that are 65 plus and those with underlying medical conditions. Workplaces, retail and personal service businesses are encouraged to exercise greater accommodation for these age groups in terms of workspace, more flexible hours of work or shopping, earlier, later, midday, or working at home options. Additional core measures specific to organisational settings are included in the resource pool on the Lionsgate website www.lgrmg.ca. Working together by staying apart was a message I spotted on an essential ferry travel journey from Duke Point, Vancouver Island to Tsawwassen. So what are the implications of staying apart and physical distancing? Lionsgate is just going to touch the surface here to draw attention to some of the challenges presented. Some businesses, simply because of their type and function, will be able to accommodate these quite easily without too much trouble aside from inconvenience. Others may find productivity seriously affected, which will require a complete rethink as to how they continue to operate and viability in operation. Think physical distancing on aircraft, that is passenger numbers per flight and fuel cost ratios. This is particularly poignant when you consider the current proposal from Air Canada and WestJet to fill all seats. Clearly they see this as the only viable way to continue to operate with margin. Think restaurants and the number of covers required to make meal sittings viable and cover the overheads. Think factory production lines where workers normally operate shoulder to shoulder, hand to hand with equipment placed for just that reason. A number of outbreaks have been associated directly with this kind of close association. Ultimately, you should be thinking safety requirements which might potentially compromise physical distancing, which has been shown again and again to be the core strand in actually tackling this virus. So let's get down to some of the specifics in terms of implications. Hard copy documents and files will be replaced by electronic documents as we seek to avoid the transfer of the virus through hands and touch. Washroom lineups will be routine, canteen and break room use will be staggered, kitchens, eating areas, on-site cafeterias, on-site gym facilities and smoking and break areas will all be affected. Open plan offices will become less people dense and unit output per square foot will reduce. Elevator protocols will come into force and multiple users will need to adjust to 1 or 2 persons maximum per elevator compartment. It will be a frustration lottery. Who manages the load from floor to floor? One-directional movement routes through offices, buildings and facilities, perspex screens at reception desks and at any customer interface, extended working days to spread staffing for physical distancing, and the extra overheads that will incur. Transit restrictions causing travel delays, living from day to day with face coverings and gloves and PPE stations and constant replacement cycles. Disinfecting, tasking that is informal and informal. Productivity bottom line versus health requirements is potentially an area for some friction. Supply chain viability. Whose connected business is no longer in business? What now for your policy suite in a changed risk world? And with all the above, how do you reduce frustrations and provocations for colleagues, clients and customers? Importantly, how will you sustain this? Because COVID is not just going to disappear. Established existing situational crime prevention theory has a role to play in COVID-19 return to work. The following 10 techniques drawn from a total of 25 from Crime Analysis for Problem Solvers in 60 Small Steps, Bly, Clark and Eck, are relevant, and they are included in the resource pool on the Lionsgate website. Technique 1 is reducing frustrations and stress. These stresses are easily encapsulated in delay and inconvenience, discomfort accompanying more or less everything we do. Latterly, the perception that our authorities are somehow failing to control borders and restrict movement is stoking the fires of vigilantism and directing stress responses. The second technique is avoiding disputes. Disputes might occur where physical distancing is poorly managed, where rules are unevenly applied, or where the imposition of restrictions raises levels of agitation. The third technique is reducing temptation. If there is any ambiguity, there is a gap for the opportunist. Absolute clarity in revised policies, procedures and protocols on return to work will set boundaries. Forward thinking is required to reduce temptation. Technique 4 is neutralizing peer pressure. This deals with a proactive approach to steer known rule breakers. You're going to have some employees or managers who are either rule breakers or bend those rules and attract willing followers. You're going to know who these folks are, so bring them in and encourage them to be positive peers during this crisis. The one thing that this COVID-19 pandemic has shown us is that there is a core of people very susceptible to peer pressure. These are the followers, regardless of consequences. The fifth technique is discouraging imitation. Leading by example is critical at this time. If your line manager pushes the boundaries around restrictions, then subordinates are going to see this as an acceptable behavior or practice and follow suit. We're all in this together. The sixth technique is setting rules. One important strand of situational prevention is rule setting. It is the introduction of new rules or procedures and the clarification of those already in place in a COVID context to remove any doubt concerning the acceptability of conduct. Follow the directional arrows, wear face coverings, cleanse hands and change out PPE are examples of rules set. Technique 7, posting instructions. Considered posting instructions which are strategically placed can have a very positive impact on behaviours while simultaneously removing excuses, employees, clients and customers. Directional arrows on the ground, 2 meter spaced footprint pads. People may use mixed messaging in their own defence, which is quite prevalent through social and mainstream media, to exclude non-compliant behaviours. In your workplace and using trusted guidance, you can remove uncertainty and provide clarity. Signage is a posted instruction, and you should have an appropriate hierarchy which includes primary signage, which are the larger and key signs identifying major areas of a building, secondary signage, which is smaller signs identifying more specific parts of a building, tertiary signage, which is less significant signage, such as those identifying restrooms, storage rooms, or legally required signage, collateral, temporary signage, flyers, etc. that are used to identify special programming or events. Technique 8 is alerting conscience. Near hand dispensers, signs cautioning how face touching transmits the virus. Perhaps signage saying vulnerable colleagues need you to keep them safe, which may appeal to a person's conscience. Technique 9, assisting compliance. Strategically placed hand dispensers to encourage use, stanchions to keep lineups separated, office furniture spacing changed to enable 2 meter distancing, and local smaller group use coffee stations to replace busier canteen facilities, and staggered breaks. Technique 10, controlling disinhibitors. Anything that undermines inhibitions or impairs perception and cognition may make people less aware or less concerned about rule breaking. so reinforce policies regarding drug and alcohol use in particular in the workplace. Problem solve and critically think through scenarios that relate to your own workplace and plan to either eliminate, minimize, transfer, mitigate, spread, or accept risks accordingly. All of this translates into the management of risk and in particular security risk. Most Canadian jurisdictions have a general duty provision in their occupational health and safety legislation, which requires employers to take all reasonable precautions to protect the health and safety of employees. Most people think of violence as a physical assault. However, workplace violence is a much broader problem. It is any act in which a person is abused, threatened, intimidated or assaulted in his or her employment. While exact definitions may vary in legislation, generally speaking, workplace violence includes threatening behavior, such as shaking fists, destroying property or throwing objects. Verbal, written threats, any expression of an intent to inflict harm. Harassment, any behavior that demeans, embarrasses, humiliates, annoys, alarms or verbally abuses a person and that is known or would be expected to be unwelcome. This includes words, gestures, intimidation, bullying, or other inappropriate activities. Verbal abuse, swearing, insults, or condescending language. Physical attacks, hitting, shoving, pushing, or kicking. Rumours, swearing, verbal abuse, pranks, arguments, property damage, vandalism, sabotage, pushing, theft, physical assaults, psychological trauma, anger-related incidents, rape, arson, and murder are all examples of workplace violence. Workplace violence is not limited to incidents that occur within a traditional workplace. Workplace-related violence can occur at off-site business-related functions, such as conferences and trade shows, at social events related to work, or in clients' homes or away from work, but resulting from work. For example, a threatening telephone call to your home from a client. If you look on the right of this slide, you will see certain work factors, processes, and interactions can put people at increased risk from workplace violence. A number of these risk factors involve our frontline COVID hero. Examples include working with the public, handling money, valuables or prescription drugs, for example cashiers and pharmacists, carrying out inspection or enforcement duties, for example government employees, providing service, care, advice or education, for example healthcare staff and teachers, working with unstable or volatile persons, social services, criminal justice system employees, for example, working in premises where alcohol is served, that is food and beverage staff, working alone or in small numbers, for example store clerks, real estate agents, or in isolated or low traffic areas such as washrooms, storage areas and utility rooms, working in community-based settings. Nurses, social workers and other home visitors would be in this category. Having a mobile workplace, a taxi cab, public transit. In fact, even domestic violence spillover is considered workplace violence. Working during periods of intense organizational change, for example strikes or downsizing. Consider having a workplace violence assessment completed and have in place a comprehensive workplace violence program. Too many companies have just a single-page workplace violence policy with no substantive program in place. A workplace violence program would include roles and responsibilities around workplace violence, shared responsibilities, management responsibilities, and worker responsibilities. Identifying risk factors for workplace violence, complaint process, informal and formal investigation procedure, confidentiality, reporting, complaints that impose an immediate risk of physical injury. Complaints that do not impose an immediate risk of physical injury, informal resolution, formal investigation, investigative process, incident follow-up, worker support, remedial action and prevention plan, notice of an injury as a result of workplace violence, domestic violence, disclosure of persons with a violent history. Lionsgate Risk Management Group have persons recognised as a competent person under the Regulations Part 20, which fall from Part 2 of the Canada Labour Code in matters concerning complaints of alleged workplace violence. First and foremost, the safety and security of our clients is an obligation that we at Lionsgate take very seriously. Security professionals at Lionsgate have completed countless residential vulnerability assessments for our clients. A discussion and thoughtful consideration of practical measures to increase your safety and that of your co-workers, family, can not only reduce your vulnerability to acts of violence, but it can lead to steps that will help save lives in the unlikely event that an attempt to harm you or your co-workers or family should occur. It is our belief that avoiding this unpleasant subject does not lessen the potential for harm and may even lead to a false sense of security. Although it is impossible to predict the behaviour of individuals under stressful situations, such as termination, there are several signs, including an employee's history, that can alert you to an increased risk of violence potential. If there is a strong suspicion of possible ROV, the organisation should obtain the advice of an experienced threat assessment professional prior to scheduling any termination. Persons of concern spend perhaps as much time at work as they do anywhere else. Colleagues and leadership are uniquely positioned to observe and be impacted by a person of concern. Background information can be obtained by doing some due diligence prior to the termination, including contacting the employee's immediate supervisor to learn about the employee's demeanour and conduct, and reviewing the employee's personal file for any past history of violence or misconduct. These two activities are an essential part of the safe termination of an employee exhibiting potential risk of violence tendencies. A security professional should also be contacted to conduct a threat assessment if any concerns are developed involving observed erratic behaviour, a prior history of threats or violence, or prior misconduct or disciplinary issues. Regardless of the circumstances, termination should be handled in a thoughtful, respectful and safe manner, and all applicable HR regulations and laws should be followed. Two other factors of note here. There is a domino effect with domestic violence, and the second is that HR deal often with hiring and succession management, but where terminations are concerned may not be equipped. The first and most fundamental potential barrier to engagement is lack of knowledge about threat assessment and management itself, about risk factors and warning signs about what goes into managing potential threats. This knowledge is a key to implementing viable strategies to reduce targeted violence. Without it, prevention efforts are far less effective because they may be then guided by assumption and fear of the unknown rather than knowledge and experience. This is where Lionsgate board certified threat specialists can assist in conducting behavioural threat assessments to predict the likelihood of violence towards the targeted person. This type of threat assessment requires collecting and evaluating information and assessing the credibility and level of threat posed. Equally important elements in the process include the development of risk mitigation and intervention strategies, communication with and education of corporate decision makers, and monitoring of the situation to ensure the safety of the targeted employee or employees. So just to summarize, design a strong violence prevention program, develop reporting mechanisms that are easy to understand and use, create organizational policies to structure and implement these concepts to encourage reporting, provide training for upstanders, leaders, and threat managers to ensure effectiveness. Where a bystander may or may not act on information, the upstander asks not what should have been done, but what can I do? And a culture of shared responsibility helps the upstander feel comfortable doing this. Organizations need to transform bystanders into upstanders. Personnel security measures should be implemented and maintained to minimize the likelihood of a security threat against employees and on-site personnel engaged in company business. Think COVID-19 as we review and consider in particular reducing provocations and reducing excuses related to COVID-19 as we review this section. Your personal security measures should include a security training and awareness process, including de-escalation techniques, dealing with aggressive individuals and disruptive behavior. Development of security messages for internal communication that will promote a security culture. Operational security of information, including the threat environment, surveillance techniques and suspicious activities, threat level response measures and policies, and physical security measures, including much tighter access controls and security credentialing, to name a few. Confrontation and communication training, personal protection training, recognition and reporting of security-related threats or incidents or information that might help detect security threats and information and cyber security. A component that tests and assesses knowledge and understanding in applying the security awareness content specific to operational requirements. A relevant security stakeholder component to enhance community awareness through various communication methods and maintain procedures to protect the integrity of training records in accordance with the organization's record retention policy. The employer shall evaluate the need to conduct background checks on employees and on-site personnel. That is, the evaluation should consider the need to restrict access to sensitive information and/or areas to only authorized personnel. The employer shall develop and implement a process to mitigate security risks resulting from the voluntary and involuntary termination of employees or on-site personnel. You're going to be dealing with difficult employees at some point, or some who are resistant to adherence to restrictions. Accountability in relation to privacy is the acceptance of responsibility for personal information protection. An accountable organization must have in place appropriate policies and procedures that promote good practices which, taken as a whole, constitute a privacy management program. The outcome is a demonstrable capacity to comply at a minimum with applicable privacy laws. Accountable organizations should be able to demonstrate to privacy commissioners that they have an effective, up-to-date privacy management program in place in the event of a complaint, investigation or audit. For example, with the COVID pandemic, at food and drink establishments, you may have seen the collection of personal information from one of your party members. This is in the event that there is someone identified with the virus. The persons who may have been in contact can be notified. The OIPC, the Office of the Information Privacy Commissioner BC, suggests explain to customers why you're collecting the personal information. Only collect the minimum amount of information necessary. Do not use or share the information with anyone other than the provincial health officer. If you do share information with the provincial health officer, keep a record. Only keep collected information for 30 days. Properly secure the collected information. It is astounding how many public, private and federally regulated organizations are not in compliance with privacy laws. Lionsgate Risk Management Group assessors are continually advising public and private sector entities on their obligations with respect to privacy. In the private sector, the Personal Information Protection Act, PIPA, regulates the information and privacy practices of corporations, non-profits, charities, trade unions, credit unions and other private sector organisations that collect, use or disclose personal information. Public bodies, the Freedom of Information and Protection of Privacy Act, FOIPA, regulates the information and privacy practices of public bodies, including provincial government ministries, local governments, crown corporations, local police forces, schools and hospitals, to name a few. Canada-wide, Personal Information Protection and Electronic Documents Act, PIPEDA, is Canada's federal private sector privacy law. Programs, policies, procedures and protocols. The 4 Ps are the instruction manuals for all our security solutions, the grease for the wheels. The work rules have changed. Every one of the 4 Ps is impacted by COVID-19 and in particular physical distancing. These are just the tip of the iceberg of many security related Ps that will require your attention during a full return to work review. Communications is the most important word in the security dictionary because without it nothing comes to pass. Communications travel in 2 directions. Communicators to information recipients, and then information recipients becoming communicators feeding back is the ideal scenario. Having a channel for feedback and staff that feel comfortable to use it is essential as it gives employees a voice. A workforce that has the ear of management that is responsive to legitimate concerns and is prepared to act, will be less agitated, more content and more productive. Communications is also about raising awareness, keeping all staff and customers apprised, and providing staff with training and education. Communication is also sharing documented programs, policies, procedures and protocols, the 4 Ps, with those that need to know. Keeping staff apprised is a sure way to ensure they know exactly what is expected of them, why it is expected of them, and how they are expected to operate. Keeping suppliers, vendors, and other external partners briefed as to your protocols is also essential. An elevation in litigation is already apparent as contingency lawyers circle because they see a rich potential client seam where organisations have failed to demonstrate they are exercising their duty of care. Organisations that are not fully conversant with their COVID-19 duty of care obligations are exposed. Put simply, as an occupier of the common property, the occupier has a legal duty to take such care that is reasonable in the circumstances to see that a person using the common property will be reasonably safe in using that property. That duty extends to the condition of the common property, activities on the common property, and the conduct of third parties on the common property. A recent ruling from the Queen's Bench in Alberta, held up in appeal, is now moving to case law and impacts on duty of care and liability specifically. The 2 court documents are included in our resource pool on the company website at www.lgrmg.ca, and the most pertinent extract in those documents is clause 38 in the original ruling, which states timely response thereto. To expand on that, you'll need to reference the resource pool. If you're in an area covered by multiple jurisdictions, then the safest bet is to meet the COVID-19 standard that is the most stringent. You can then readily demonstrate that you are adhering to and even surpassing the requirements of public health, provincial diktats or federal requirements. Employers must ensure enhanced communications exist between those accountable for cybersecurity operations and physical security functions. Risks may appear in one operational area, triggering the need for review in the other. These areas are often handled in isolation. As high as 90% of corporate security issues come from end user devices. This means that the implementation of a security solution that is integrated and enforces security policies right from the user's desktop all the way through the network and out to corporate resources on the internet is critical. Intrusion detection systems and intrusion monitoring work most effectively by enforcing company IT policies that integrate with firewalls, routers, switches, and endpoint devices to enforce and alert on potential issues. We recommend detailed logging of networking events, ensuring current warranty coverage, and updating hardware in critical areas, ensuring good password enforcement policies and user tracking, and creating standards for accessing organizational resources. These are just a few of the areas that are key risk mitigation, and being able to track down the source of any potential attacks or unauthorized access. Allowing unmanaged devices access into your company network is an example of a commonly overlooked risk. Creating standards for devices and users around how data is accessed is a great starting point for increasing cybersecurity from the inside out. Enabling the rapid repair or replacement of component parts is one thing, but a successful return to work is also reliant upon operations-dependent connected partners. COVID-19 has put a large number of businesses out of business, and restrictions going forward are going to alter the speed at which companies are going to be able to repair or replace critical components or parts. Organizations that maintain an inventory of critical spares are well placed to deal with this, and organizations that include this in their business impact analysis will be able to reconsider their ordering strategies. A protracted manufacturing delay could result in considerable financial loss, brand and reputation damage, and loss of customers. Employers should evaluate site or building locations across their building inventories in order to develop a current understanding around the availability of supplies of electricity, water, and other utilities, including emergency backup should a security threat or vulnerability arise. Utilities should be within a secured area to best support ongoing business operations. As supply chains may be challenged and delivery options fewer, employers are encouraged to keep current, identify and review their inventory of critical components and critical spares. Supply or asset deliveries should be closely monitored to ensure that existing security measures are adhered to, especially important as PPE and sanitization protocols must be coupled with many different company delivery protocols. Critical components should be protected and critical spares should be securely stored in regular inventories should be taken to identify losses, and inventory records should be kept based on the nature, value and risk of loss. There should be procedures in place as well for obtaining or sharing equipment, parts or supplies between companies and suppliers in the event of a security incident. Security managers are always fighting against grudge purchase syndrome, and this is often born of a misunderstanding of security risk management and its return on investment potential. You're going to nod your head as you recognize how common these pitfalls are within organizational management structures, which are invariably wrapped in internal politics and bureaucracy. One of the challenges many security directors and managers have to deal with is a lack of understanding outside their own departments about what security risk is. Good risk management is difficult to implement, and failing to grasp that single fact may explain why many organizations that live with risk every day get the management of risk wrong. The 7 core reasons why this is the case are that the potential interaction of multiple risks was underestimated or disregarded, probabilistic modeling was overemphasized, shortcuts were taken, scenario planning was underused, transparency into potential issues was absent. Risk managers were isolated in silos. Warnings were ignored, and those who delivered them were dismissed as negative or criticized for not being team players. A short short-term perspective was adopted with a single-minded focus on making the quarterly financials. Companies lacked a comprehensive approach to firm-wide risk management. Authority and responsibility were poorly controlled and defined. Risk management often focused on compliance rather than performance, leading to inadequate assessments and responses. Employers should adopt a dynamic security management program methodology rather than a plan. Plans are based on theory, programs are based on results. Plans are dormant, programs are active. Plans become obsolete and programs evolve. We apply experience here at Lionsgate to develop client-specific hybrids, flexible enough and adaptable enough for any organization, regardless of size or sector. The most important consideration is to avoid excessive formalization and the overly complex methodologies that cause immediate content blindness, meaning that reports never properly see the light of day. Risk assessment methods as a mean to identify and countermeasure options are not beneficial if they are presented as excessively detailed, overly quantitative, or if they are not integrated into the management decision-making process. Select and apply analytical tools that are appropriate for task and in the context of your organizational decision-making system. A program and the continuous monitoring of risks best prepares any organization to counter threats as they emerge. The traditional risk vista is now changed, and short-term, intermediate and longer-term risk horizons need revisiting. Within the risk process, the order of priority for risk assets has changed. The people paramount emphasis is far greater, and information assets require broader attention. A whole raft of new threats has entered the fray. I keep 6 honest serving men. They taught me all I knew. Their names are what and why and when and how and where and who. That's by Rudyard Kipling. So what might happen? Why would it happen? When could it happen? How will it happen? And where would they attack, and who is the adversary? With particular focus on COVID-19 and why, how and where, are you accessing commercially available big data to make more focused and commensurate risk decisions, as well as accessing broader contact tracing data? Do you commission research and then analysis of open source information and intelligence to support strategic decision making? Pro-COVID-19 vulnerabilities remain as gaps unless mitigated, and new threats means new gap analysis. A documented risk assessment process for the review of assets, threats and vulnerabilities to evaluate the likelihood of identified threats occurring or reoccurring, COVID-19, should be incorporated in a dynamic risk matrix. Carefully considered, layered, balanced risk mitigation measures to address COVID-19 restrictions will be essential. Findings and recommendations from the security risk management process should be communicated to management for decision making. Lastly, what better way to review an update than by doing so using a program approach in real time? Employers must continually evaluate security measures that are implemented and maintained in order to minimize the likelihood of a security threat against employees and on-site personnel engaged in company business. Post-pandemic return to work sites may yield different work patterns, different employee group locations, etc. Existing security measures should be refreshed to ensure adequacy and optimal coverage. Under the microscope, again, are all security measures and the criticality of people, property and information assets that require physical security protection. A number of the items listed below have already been addressed, so are not spoken to here. Some items remain unchanged as a result of COVID-19, while the remainder are due reconsideration with COVID-19 restrictions in mind. A snapshot of considerations includes facility design and construction, SEPTED, crime reduction or crime prevention rather through environmental design, or safe design standard. Design has a unique role to play here. When we consider building functionality and minimizing imposition with COVID physical distancing layouts, there is plenty of room for SEPTED innovation. SEPTED is familiar to most security consultants, but the safe design standard is probably a new concept to you. This outstanding advancement in crime reduction through design can be reviewed in more detail at www.safedesigncouncil.org or on the Lionsgate website www.lgrmg.ca. Having a behavior regime and rules inside your facility is one thing, but is this supported by pandemic-enhanced access controls at entry points and exit points and site perimeter integrity? Does your existing signage need to be changed? Are new COVID signs required, triggering revised privacy impact assessments? Are formerly valid but now redundant signs still out there needing to be removed? Are your gates, entrance doors, control points of access for vehicles and pedestrians, as well as having entry controls electronically, do you also have electronic access controls for our authorized users? Does your security lighting provide clear lines of sight for natural and formal surveillance after dark? And will extended working hours necessitate a change in lighting schedules? Is your video surveillance covering areas required in your COVID-controlled new world? Are you utilizing video surveillance to help with internal contact tracing verification? Are you contemplating the use of thermal monitoring detection equipment to measure staff, visitor, customer, contractor body temperature? Have you considered the privacy implications of doing so? Privacy impact assessments should be undertaken which, acted upon, will also offer additional insulation for companies who could face civil litigation. What are your response plans if you encounter an individual that is symptomatic? Have you considered the need for engaging a health professional for advanced testing? Is your site properly managed to prevent circumvention of your measures? You may find you need security guards not just to control access, but also to ensure compliance with COVID-19 restrictions. So do you have written procedures and protocols to support the function and role? Finally, are your measures ARC? That is appropriate, realistic, and commensurate with risk. A second wave of COVID-19 is now highly likely, and without border integrity or control on movements, the reintroduction of emergency measures could force a second close down of non-essential workplaces. There's good reason why the border with the USA has been closed indefinitely, and certainly through the summer months in BC. In the event of security emergency events, are your internal protocols established to ensure that the Chief Security Officer liaison is concerned? Because this officer will ensure executive briefings occur around any event as appropriate. Your corporate crisis communication plan must include communication procedures, capabilities and resources, and contain a current telephone directory of various groups to be contacted during a security-related threat or incident. In addition, and related to working and coordinating with other agencies, current contacts who are part of a response to a security-related incident or threat should be included. You should maintain formal incident report logs and records to serve as an official record of actions and lessons learned from post-incident review. Documentation should be retained in accordance with the required information security management process. Your organization must have corporate protocols that are assigned to the implementation of security countermeasures identified and based on the security risk management process. The security countermeasures should be coordinated with the employer's emergency management procedures, and these will include bomb threats, suspicious packages, workplace violence, which we've covered in detail, theft, terrorism, vandalism, civil disturbance, which is prevalent with COVID-19, unauthorized entry, control systems or information technology attack, and suspicious activities. And right now, a second wave of COVID-19. Your understanding of procedures for emergencies that bring about changes of the threat level and security requirements of company facilities should include notification of employees and on-site personnel, reporting and appropriate security responses, and all required investigation procedures for security-related incidents. The relaxing of lockdowns and the easing of social connecting rules has seen less adherence to physical and social distancing with very predictable consequences. The failure of some individuals and groups in our society to conform to public health guidelines exposes all of us, and we need to be extremely alert and remain vigilant. That concludes this presentation. My thanks again to my colleagues Mike McCafferty and Susanna Perpick for their support and assistance. Thank you as well for taking the time to listen. I hope you've been able to take away a number of actionable nuggets. Please visit our website www.lgrmg.ca and access resources and services either supporting this input or of direct value for your security needs. As the slide says, we're here to help. So pick up the phone and call us on 1-604-383-0020 and ask to speak to the risk team.